as shown on this chart, you can see that the news is less positive when we begin to look at hospitalizations. I do remain concerned about the high number of COVID patients at Frederick Health Hospital. Today, there are 35 people in the hospital with COVID-19, and this is slightly down from last week. Hospitalizations, however, remain very high and are higher than what we experienced at this time during the first wave or surge of the virus last spring. There are 10 COVID patients currently in the intensive care unit. That is up from yesterday. And I will say that does mean that the ICU unit is at or near capacity, maybe completely full. Their ICU has 19 beds, and so likely it is full. Frederick County's hospitalization rate is of a concern because that's been our focus. Our focus has been to flatten the curve and to reduce the strain on our hospital and healthcare system. And so certainly the staff at the hospital continues to work very hard to care for patients that have COVID, but that's in addition to all of the other patients who are in the hospital who do not have COVID. So while more than half of the ICU beds are filled with COVID patients, there are many non-COVID patients who are in the ICU in the balance of the hospital as well. Statewide and nationally, hospitalization rates are declining. So it is of concern to me that we have not yet seen the same types of decreases in hospitalizations that others have seen in the state. We also continue to see outbreaks of the virus in our county, including in our nursing home and assisted living facilities. The state is reporting 11 different Frederick County facilities this week with cases or outbreaks of coronavirus. And we also are aware that there are between 20 to 25 outbreaks in places of employment in the county. So again, I need to continue to stress to everyone their need to take their precautions. We are not out of the woods. The virus is still with us. It's unfortunately high, and I need to ask people to continue to wear their masks, to physical distance, to practice good hygiene, and to avoid places where there are crowds and avoid gatherings. So again, we need to continue to do that for the foreseeable future. While we have seen some of our metrics improve in the right direction, I'll share a few of those. Our positivity rate is slowly improving. We dropped below 5% this week for the first time since early November. This morning, the county's positivity rate was 4.82, which is down from 5.63 last week at this time. But we do remain higher than the state average, which is 4.17. The county's 7-day rolling average of new cases per 100,000 population has also improved, but again, is higher than the state average. We currently have a rate of 18.33 cases per 100,000 people. That's up slightly from yesterday, but again, it's better than where we were last week when our rate was over 22. The statewide average is lower at 4.42, and that improved versus yesterday, while ours actually got slightly worse than yesterday. We unfortunately continue to see deaths in our community, and we continue to lose longtime members of our community. And this is devastating for these individuals and their neighbors. In the past week, 8 more people lost their life to COVID in Frederick County. And as of this morning, 256 of our neighbors have died because of COVID-19. And I want to say that that number stood at about 130 on November 1st. So this number has actually about doubled over the last few months because this winter surge has been far worse than what we experienced last spring. You can certainly track all the details that I've shared with you here today on the county's coronavirus dashboard, which is updated every morning at about 10 a.m. And the website is frederickcountymd.gov/COVID stats. I also track the number of COVID patients who are transported to the hospital by our fire and EMS crews. Since last Thursday, our crews have transported 31 patients known to be positive for COVID, and an additional 32 people who have shown symptoms. And again, unfortunately, this is higher than last week. Last week, we transported 23 positive patients, and this week it was 31. And again, that number is higher than our weekly average that we experienced during the spring surge of last year. So I am pleased, however, to share that as of Monday, the Division of Fire and Rescue Services had only 2 employees in quarantine or isolation. And that is the fewest number of affected staff we've had in that division since early last summer. On the statewide coronavirus dashboard, we see current outbreaks in public facilities. That includes the Victor Cullen Center in Sibyllsville, which was slightly higher than last week, with 22 staff members having had confirmed cases. Now, I will note that this number is cumulative. It is for the entire pandemic, so it's not really necessarily reflective of the current number. And no staff have tested positive. The state also is reporting that there are cases at the Adult Detention Center, and in a few minutes, I'll ask Lieutenant Dieter to talk about the situation at the Detention Center. So Frederick County Public Schools has reported 7 staff cases and 6 student cases, which is a little bit more than the prior week. Though I do not want to suggest that this is because we had hybrid school for one day. So I want to move on to the vaccination effort. You know, our top job within public health and the county government is to vaccinate as many people as we possibly can. Our clinics are running very smoothly and efficiently, certainly as long as the weather cooperates and the vaccine arrives in time. As you can imagine, with snow days like today, it is difficult for people to travel to schedule clinics. So our clinics today have been canceled and rescheduled for Sunday. However, there's also been a delay in receiving shipments of vaccine. So our first dose shipments for this week have not yet arrived. And that's really a reflection of the weather situation across the country. And I think this is happening across the country. Our progress with vaccination is also slowed because of the lower or fewer number of doses that we are receiving each week. And I'm talking about first doses. The demand in the county remains very high for vaccine, and it greatly exceeds the supply of vaccine that is available. So the supply of vaccine and the limitation of vaccine continues to be our greatest challenge. This week, the health department has not yet received the 1,300 first doses we are expecting and have been allocated by the state, again, due to bad weather. Now, even if we had received the 1,300 doses, it does not go very far in a county of 260,000 people. We've been told to expect the same number of first doses, this 1,300, this week and each week for the following 3 weeks. So it does create some frustration, which if you've read the Frederick News Post this morning, you saw my expression of concern over the fact that fewer doses are coming, not just to the health department, but into Frederick County in general. And these doses have shifted to private sector pharmacies, but also shifted to the mass vaccination sites, which have opened in the state of Maryland. I do want to say that knowing what to expect, knowing the fact of how many doses we're going to get for the next few weeks is an improvement. It does allow us to plan and schedule our clinics, even though the weather has thrown a kink into that. So until this week, we would often not find out until Saturday what our allocation was for the next week, and often that would not arrive till Tuesday, sometimes Monday, sometimes Wednesday. So providing a predictable distribution schedule of vaccine each week was certainly one of the topics that county leaders from across the state raised with Governor Hogan earlier this month. And I appreciate that we now have been given some advance notice of our weekly allocations. We're still hoping to learn how many doses are being allocated to the pharmacies, the private sector pharmacies in our area, and specifically to the mass vaccination sites. That was another request from county leaders to the governor. In Frederick County, we know that the pharmacy at Giant off Route 26 in the city of Frederick is receiving 200 doses per week. And we know the CVS in Urbana is now scheduling vaccinations, but we do not know how many doses they have been allocated. And the private pharmacies are vaccinating people who are eligible in groups 1A, 1B, and 1C, while we are working through some of the subgroups in a little bit different fashion. So the reality is that we are receiving fewer doses in Frederick County. It's just a fact, and it is a concern for us here in terms of our local public health clinics, as well as the hospital, who's been a fabulous partner with public health throughout the pandemic. So I will continue to advocate for more vaccine to be made available to the health department as well as to the Frederick Health Hospital. We have really had a very coordinated effort with the hospital, and it's really been a good working relationship. And sometimes we forget that that may not be usual, but we're very fortunate in Frederick County to have some great partners in healthcare. So working together, the hospital and our health department have posted high vaccination rates, high rates of distribution of the vaccine we've received, And we've sometimes been literally the best in the entire state. So last week, our health department had administered more than 95% of all the first doses they had received, even despite bad weather disrupting some clinics. And Frederick Health had administered 104.8%, which was the highest rate for all hospitals in Maryland, or the second highest rate for all hospitals in Maryland. So now I will turn it over to Dr. Brookmeyer to give us updates on the vaccination effort, including the way eligible residents can sign up for a vaccine. So with that, I'll turn it over to you, Dr. Brookmeyer.
Yes, thank you, County Executive Gardner. So as you had mentioned, in Frederick County and statewide, the governor has announced that in Maryland, we're serving persons who are 1A, 1B, and 1C, that everybody's eligible. And once somebody is eligible, then they continue to be eligible even as each of the vaccination locations goes to serve the next priority group phase. Unfortunately, though, there is not enough vaccine available for everyone who wants to be vaccinated at this point. And in Frederick County, we're currently serving from the health department and in conjunction with the hospital. But so with the health department at our clinics, we're serving persons in priority group 1A and persons in priority group 1B. And consistent with the priority established by the governor, is that we are to also prioritize persons who are age 65 and older. And in fact, the direction is that we are to prioritize above all others, persons who are age 65 and older. And when we look at that group in Frederick County, when we look at that group 1C, persons who are ages 65 to 74 years old, we have already pre-registered over 17,000 individuals who are in that age group. So with our receiving what we're hoping will be a consistent allocation number that we can start planning with is 1,300 doses a week for this week and for the subsequent 3 weeks. So if that's all we're receiving is 1,300 doses, it's going to take us a long time to get through the governor's priority for the health department, which is to vaccinate persons who are 65 and older. And in order to provide what we hope can be a more predictable position for people to know where they are in the priority list. So when we're looking at the age group folks, the persons who qualify based on their age, now that we are believing that we will have a predictable amount of vaccine coming in for this week and the next 3 weeks, that will enable us to now start providing better information for people as to where are they in that priority grouping list. So when we have over 17,000 persons who are age 65 to 74 who would like to be vaccinated, we wanted to make it possible for it to be more predictable for people. So we are going by age groups, so by age cohorts. And we're currently serving persons who have been born in 1947 or earlier. By going by those age groups, that will allow us to be able to offer greater prediction. It'll still be a rough estimate, but it will at least enable folks to know, oh, okay, so I was born in 1953. I still will be waiting for the people who are vaccinated in earlier years, but I know when they get to persons born in 1952, I know that my turn is coming up soon. So we hope that people will find that level of predictability, although it's not precise, and there are many variables that will be interfering with it. For example, having a different allocation of vaccine that might occur, or having a vaccine delay, or some other reason it might cause us to not have as much vaccine as what we had factored into that calculation. And also we will have additional people who pre-register each week for this category. So we could also end up having more people in each age group than what we might have predicted 2 weeks in advance. So I did want to show you the dose numbers that the health department has received week by week. And this most current week, while we are scheduled to receive 1,300 doses, we did not receive it on Monday, Tuesday, or Wednesday, and today's Thursday. So we are hopeful that this nationwide weather storm impact of distribution will enable us to still receive vaccine prior to our rescheduled clinics due to the weather. And when we look at the percent of persons from Frederick County who have been vaccinated, almost 12% of the Frederick County population has received the first dose and 5% have received a second dose. The Frederick County Health Department has been the single largest vaccinator of Frederick County residents. And we hope to continue to be able to receive enough vaccines so that we can be a significant vaccinator, especially in the absence of us having identified local vaccination locations for people. So as the county executive had mentioned, our website, when people see it, for vaccination pre-registration, you will recognize this blue screen like what's displayed there. That helps you to know you're at the right location. But also, as the county executive had mentioned, that with the doses coming into Frederick County, so between the health department and the hospital, this week we're receiving 400 doses less than last week, which was also a reduction from the prior week. And that was also a reduction from the prior week. So as we continue to see the total number of doses coming into the health department and the hospital decreasing, we unfortunately have to encourage people who are able to go to these other locations, the mass vaccination sites, as they are receiving increasingly more doses, or some of the pharmacies. We wish that we would have a system where people would only have to sign up at one location and they could then be on the list to be called up for each of those locations and scheduled for appointments. But unfortunately, it's not that case. But our pre-registration system, that's what we would encourage people to use for the Frederick County Health Department's vaccination. And should the hospital ever receive more vaccine again, the hospital is also interested in and collaborating with us on serving the community by using that pre-registration form and making it so that people don't have to register at yet one more location. So those mass vaccination sites in Maryland, Six Flags America, the Baltimore Convention Center, they're going to be opening up M&T Stadium on the 25th. There'll be some other clinics opening up around the state. And in Hagerstown, apparently they're planning a location there. So what I encourage people to do is go to both that website there, the covidvax.maryland.org, and there's also a telephone number for a support center, the 1-855-MD-GO-VAX, so MDGOVAX. They're operating that call center 7 days a week from 7 a.m. to 10 p.m. I do want to also share with you some of the behind the scenes type work that I've received some questions about and realized we hadn't been talking about what we have been doing to serve individuals who are having transportation and mobility difficulties. The partnership that we have with the Department of Fire and Rescue Services through their Mobile Community Health Program, they've already for weeks now been vaccinating persons living in independent living communities, so the senior independent living communities, especially the ones where persons have lower incomes. And also they've been providing vaccinations on site for the behavioral health congregate living facilities, which are also in the priority group 1B. And we're also working on other locations around the county for mobile services. We are enjoying the partnership that we have with the county senior services division, working on an outreach for individuals who are homebound and receiving in-home services. And we're also working on an accessible clinic for individuals with intellectual and developmental disabilities, for individuals and families of individuals who would like a clinic space and a clinic process that might not be as fast-paced or as noisy as our usual clinics are. And we are also working on the drive-through option, which will be coming soon. So those are some of the things to look forward to, and some of the things that are going on that we're just not normally talking about because it doesn't apply to the entire population. So the variants, I do want to briefly say that, variants, so these are messenger RNA viruses. It's quite typical that they do change, that there are mutations, and as they spread person to person, the viruses, that's when they have the opportunity to mutate. So one of the ways to reduce the potential for mutations to occur is for people to not become infected, because it's when the viruses move into another person that genetic reassortment can occur. When we look at these variants, there was an announcement yesterday that the Brazil variant, the one that's referred to as P1, that there was a person from the National Capital Region who had a history of travel, international travel, who had unfortunately died, and that variant was recovered. But we do have the other ones, and the one variant is already in 42 states, so it is spreading, and the state continues to monitor for those variants. I do briefly want to say that there are common reactions to the vaccine that people see. The most common after the first dose is their arm will be sore, pain at the injection site. Sometimes about 6 days later, 6 to 10 days later, some people might get some redness on their arm too. That's been noted in the clinical trials in about 9 to 10% of individuals who've been vaccinated. And the side effects that we see are more common in younger persons than older persons. After the second dose, it is not uncommon for people to have a fever, fatigue, muscle aches. It's mostly mild or moderate and goes away after a couple days. And that also is more common in younger folks. So if people do want to report a reaction, there is the vaccine adverse event reporting system that individuals or their healthcare providers can report to. Like today, one of the questions is, what happens if the vaccination clinic is canceled due to the weather? And so what we will do is we will notify individuals by email if that's the way that they have registered, and for other individuals who they have registered via phone, then we will reach out to them via phone to let them know. And this week, the clinics that were scheduled for Thursday, we're moving all of them to Sunday, and people have their same time that they had for Thursday. They will also have that same time on Sunday. We will make plans to accommodate all the scheduled appointments if the Sunday doesn't work for individuals. Some people ask, well, what happens if my second dose is delayed for whatever reason, like say weather? And so what I would say is that ideally we would vaccinate people on the timing that the clinical trials had studied the most, which is for the Pfizer product, 21 days. After the first dose is when people would ideally get the second dose, and for Moderna, 28 days after the first dose. But there is leeway. We try not to have it be any sooner than the 21 days or the 28 days, and actually there's a definite where it says for each of those vaccines, don't do it before a certain number of days prior to when they're next due. But there is more leeway on the far side of the 21 days or the 28 days. And so we're supposed to vaccinate people, and ideally would vaccinate people as close to the 21 or 28 days. But if it's a week or maybe even 2 weeks after that, that is also thought to be okay. And I have received questions about second dose shipments. Have they been delayed? Because there have been some reports in the newspaper, both in Maryland and then also outside of Maryland. And so at this point, for the Frederick County Health Department's second doses, we continue to receive those shipments and have not been impacted as others have been. And as the county executive had mentioned, that after I get my vaccination, do I still have to wear a mask? And the answer at this point, based on the available knowledge and research, is that yes, you do need to continue wearing your face covering. There is reason for that. And until the research indicates that we're able to have the community transmission really at a low enough level, it's still important for people to wear face coverings, keep their distancing. I do want to say that the Vaccination Appointment Center, we have assisted over 10,000 callers already, and we're continuing to improve the call technology. And again, to emphasize, if persons were born in 1947 or before and they have not heard from us, either they have registered or they haven't registered, please call that number and we can assist the individuals. We did have some people who did register online, but their telephone numbers didn't work or their emails didn't work. So there are still some people that we know had pre-registered, but we haven't been able to reach. So that is the end of my prepared presentation. I appreciate being able to share the information this week.
Thank you, Dr. Brookmeyer. I know this week was expected to be one of the busiest weeks yet, with clinics operating in 3 locations per day. And certainly we're administering thousands of second doses in a timely manner. In fact, because of decrease in first doses, we're actually, for the second week in a row, now vaccinating more second doses than first doses. We're fortunate to have community partners working with us with our clinic efforts. In December, we had representatives from Frederick Health speak at one of our briefings to talk about their role in the rollout of COVID vaccines. And as I mentioned earlier, the hospital has been working hard, hand in hand with public health and other county agencies throughout the past years we've battled the pandemic. With schools reopening this week, our school nurses who are administering vaccines at some of our clinics have returned to their regular jobs in our schools. So we've had paramedics and EMTs from the Division of Fire and Rescue stepping in to assist at our vaccination clinics. Our Division of Fire and Rescue Services also has worked with staff from the Frederick County Sheriff's Office to help set up our clinics. And law enforcement officers from both the Sheriff's Office and the Frederick City Police Department have provided security. So joining us today is Lieutenant Jason Dieter, who will talk to us a bit about the role the Sheriff's Office has played, as well as to clarify any confusion surrounding COVID at the Adult Detention Center. So with that, I'm going to turn it over to Lieutenant Dieter.
Thank you. Hello, my name is Jason Dieter. I'm a lieutenant with the Frederick County Sheriff's Office. I'm going to provide you with an update of the Sheriff's Office involvement with the planning and participation in the 3 vaccine clinics, and an update of current COVID-related matters within the Sheriff's Office. I would first like to take the opportunity to thank County Executive Jan Gardner for providing the Sheriff's Office the opportunity to update the community on the Sheriff's Office involvement in the vaccination sites. The Sheriff's Office has worked closely with county partners from the Health Department and the Division of Fire and Rescue Services and the Frederick Police Department to plan, coordinate, and initiate each of the 3 vaccine sites located within Frederick County. The Sheriff's Office completed a security and safety survey for each location before the vaccine clinic is made operational. The Health Department has acted on all concerns addressed in the security and safety survey. Currently, the Sheriff's Office provides a deputy to each of the 3 vaccine clinics during the hours of operation to provide site security and assist staff and the community. The Frederick Police Department has assisted the Sheriff's Office with site security at the Scott Key Center location. I'd like to remind county residents not to be alarmed by the presence of a deputy or the Sheriff's Office equipment at the vaccine sites. They are there to ensure the safety of the community and the staff. We have received many compliments from the community regarding our deputies and the services being provided by the staff at each of the vaccine locations. If you have any concerns while visiting a vaccine site, please don't hesitate to ask a deputy for assistance. Moving on to the Sheriff's Office COVID-19 operations. We are continuing to operate in accordance with recommendations from the Frederick County Health Department and the Centers for Disease Control. Currently, 40% of deputies have been vaccinated with the first and second dose of the vaccine, and there are no current cases within the Sheriff's Office of COVID-19 or even being on quarantine. The Frederick County Adult Detention Center currently has 10 active COVID cases amongst inmates. There are no COVID cases amongst staff in the detention center. Currently, the detention center has 44 high-risk inmates for COVID-19. Out of the 44 high-risk inmates, 34 have received the initial vaccination, while 10 inmates have declined the vaccine. The 34 inmates are scheduled to receive their second dose later this month. I would like to thank again for allowing me the opportunity to update the Frederick community. You can rest assured that the Sheriff's Office will continue to work with county partners to provide the highest level of service you have come to expect from Frederick County government.
Thank you, Lieutenant Dieter. I appreciate all the help the Sheriff's Office and our other public safety agencies have provided throughout the pandemic. I really want to say thank you to everyone who has really worked together to make sure that our Frederick County vaccination clinics have been exceptionally well run. We are ready to vaccinate more people. We just need more vaccine. And I do want to say we're also ready to vaccinate our educators. But again, we just need more vaccine. And we do make a request each week for an allocation for our educator group. If you know someone who's eligible for a vaccine but is not in a group being served by our health department, please let them know that they can sign up also with one of the private pharmacies, or if they are able to travel and register at one of the state mass vaccination clinics. It is unfortunate, and I really am reluctant to encourage people to travel outside the county, but that is where the vaccine doses have shifted, and that's where they are available to people. You can find a full list of vaccine providers in the state by going to coronavirus.maryland.gov and look at the toolbar across the top for Find a Vaccine. As a reminder, Frederick County has a call center to help our seniors who do not have internet access to schedule vaccination appointments. The call center is available Monday through Friday between 8 a.m. and 5 p.m. It is open today. The number is 301-600-7900. And for Spanish speakers, the number is 301-600-7905. If you or anyone who is 75 years or older have not yet been vaccinated, we would appreciate you calling us. We have tried to reach out to everyone in that age group to make sure they are vaccinated. Vaccines are certainly the long-term solution to controlling COVID-19. With only 11% of our population vaccinated so far with one dose and a smaller percentage with two, it will take time before the vaccines are broadly in our population to help make a difference to the spread of the virus. So even people who have been vaccinated can spread the virus, so everyone must continue to wear a mask, wash your hands, and watch your distance. Wearing a mask, or even two, as some experts are now suggesting, is a key step in slowing the spread of the virus. Because hospitalizations remain high in Frederick County, my executive orders regarding restaurants' hours and the serving of alcohol will continue to stand. It is scheduled to expire on next week on Monday. I had certainly hoped to be able to lift that executive order last week and again this week, but unfortunately, hospitalizations have remained high, and I feel that I'm unable to do that at this time. I also have one other executive order that is related to indoor recreation, and I will revisit that as soon again as we see hospitalizations improve. Now, I do want to talk about grants and what we're doing to support our restaurant industry and others. Last week, I announced that the county was offering a second round of KN95 masks to our restaurant workers that have requested them for their servers. We had 62 businesses complete the survey, and the Office of Economic Development will be sending out through the mail 4,000 KN95 masks to these restaurants. The county is donating these masks to help protect our restaurant servers because they are exposed to people when they are eating and drinking and unable to wear a mask. Diners can do their part to protect servers too. Remember that until food is actually served at your table, everyone needs to be wearing a mask, and that is consistent with the governor's executive order. The only time masks are permitted to be taken off is when diners are actually eating or drinking. The distribution of masks to our food service industry is one of the many programs Frederick County has offered to support our business community during these difficult economic times. 2 weeks ago, I announced our hospitality and lodging grants to help that industry. It's also really been economically hard hit by the fact that people are not traveling. The program is the latest in a series of grants that the county has offered to support our business community. Since June, we have awarded more than $10 million through a variety of grant programs that have targeted our small businesses, farmers, childcare providers, and our food service businesses. The application period for the first round of hospitality grants ended last Thursday afternoon. So today I'm pleased to share that 17 Frederick County businesses will be receiving funding through the Hospitality and Lodging Grant Program. The amount each hotel or bed and breakfast will receive is based on the number of rooms they rent. There were a total of 1,546 rentable rooms among the 17 grant recipients. Funding for this program was provided by the state, which required the county to split the pot of money into 2 rounds of grants. So the first round, which we're distributing and has been awarded, is $411,000. Now, our goal is to have this money deposited into the business bank accounts by the end of this week. And I have some other news to announce as well. Today, we're launching round 2 of the hospitality and lodging grants. Now, all the businesses in this category who've received grants in the first round will automatically be awarded a second grant. They may be asked to approve an electronic grant agreement on or around March 1st. Our hotels or bed and breakfast operators who want to apply for round 2 and maybe did not apply during round 1 will have until noon on Wednesday, February 24th to submit their applications. And those applications are available at frederickcountymd.gov/hospitality grants. So if you're in this industry, please take advantage of this grant money. This really is out here to help support you weather the pandemic so that you can thrive again once the pandemic is over. If you have any questions, you can contact our Office of Economic Development at oed@frederickcountymd.gov. So in closing, I do want to say, as we conclude today's briefing, that it is important for everybody to continue to do their part to slow the spread of the virus. We still continue to have a high rate of spread, even though our metrics are trending in an improving manner. It is up to each and every one of us to do our part and to take our action. And please know we will continue to advocate for more vaccine for our most vulnerable citizens, for our frontline workers in a variety of industries, and for our educators. So stay safe, stay healthy, stay informed. And thank you for joining us for today's public information briefing.
Frederick County has opened vaccination clinics and are beginning to accept appointments for people who are eligible for the vaccine. Vaccination information can be found online at frederickcountymd.gov/COVID vaccine.